Hello and welcome back to CX Network's Feedback and Satisfaction online event. I'm Shanice Henry, Editor-in-Chief of CX Network, and I'm co-hosting this event with my colleague Jennifer Pham. So I hope you've been enjoying the session so far. We just wrapped up our session with Oracle's VP of Innovation and Design, Brian Curran. A very insightful session. We were looking at connecting empathy with business value and making sure that we're not making decisions on gut feelings and bias, but in fact, we're basing our decisions on customer data, on the voice of the customer, and letting our decisions be rooted in their needs and wants, while of course listening to them consistently via a range of channels at our disposal. So if you didn't check that out or didn't get time to check it out, please do make time for it at some point. But next up, we have Sean Nason, founder and CEO at Mophie, and we also have Colleen Bement, Director of Sales Americas at HappyOrNot, and they're going to be presenting a case study to us today, diving into how Walmart Health uses feedback data to enhance their customer experience.
What if we said the current healthcare industry offers a bad experience, and that for many busy families lacking adequate medical, dental, and vision insurance, it's basically broken? Well, it is. Doctor visits impact everything from time to family budgets to an overall sense of well-being. 1 in 4 busy families worry about the cost of a doctor visit, and at least 1 in 3 don't seek care at all because of cost and complexity. These families need a healthcare transformation that impacts cost, convenience, and care without sacrificing quality. But what can Walmart do to help? We have a vision to deliver a customer-driven care experience that values time, money, and well-being. And how can we do this? By listening to our customers and removing the friction points that keep them from seeking care when they need it. Introducing Walmart Health, a new offering that brings services like medical, dental, and vision together under one roof. We'll help Americans live better by providing a care experience that values their time, saves them money, and offers a higher level of well-being. This bold vision of solving busy families' biggest care needs also reinforces the Walmart brand promise to save money, live better, by making healthcare affordable, easy, and caring. Multiple same-day appointments and bundled services will help busy families get more done in one visit, with convenient locations and hours to better fit their schedules. We will build an integrated in-store experience that seamlessly connects all our services under one roof, with a streamlined digital experience that includes easy scheduling and check-ins, plus the goal of transparent pricing, so they'll know upfront what they're paying for the appointment. Our associates and providers will enrich the customer journey by being friendly, respectful, and customer-focused, assuring the customers know they are getting care from people who actually care. And with the convenience of these clinics being connected to a physical Walmart store, pharmacy, and vision center, we can also help busy families get more done on their visit. If we can get it right for our customers by offering affordable, convenient care all under one roof, Walmart Health will help create a better healthcare experience for everyone.
He's unwilling to separate his pastor's heart from his work in the business world. He unapologetically challenges healthcare leaders to quit the bullshit and think bolder about how to actually improve people's lives. So without further ado, take it away, Sean Nason.
Thank you, Colleen, and thank you, everybody that has joined this webinar. It's great to be a part around this great work that's in partnership that Walmart Health and HappyOrNot has done, and to share a little bit about the journey that has taken place over the last 12 months. So again, I'll tell you a little bit about myself, and then we'll jump right in. In my 4th career, as when I started Mophie, have worked in the healthcare space for about 10 years, spent 7 years at the Walt Disney Company, as a Walt Disney Imagineer for part of that time, and then moved into healthcare in 2011, and been with this journey with Walmart since August of 2018, and the amazing team there. So I'm going to present a few numbers here this morning for us to think about as we start to think about how we have partnered with HappyOrNot and what we use HappyOrNot for on this journey. So you'll see this number here of 28,000. And 28,000 actually represents the amount of of consumers that we have worked with, talked with through quantitative or qualitative research in launching the new Walmart Health clinics in the state of Georgia. Worked with an amazing team within Walmart, and was part of that team from their insights group to their CX group and our group to reach these 28,000 consumers and customers to start to direct the direction that we were going to go when we launched Walmart Health. The next set of numbers here, 4,800 versus 5,200. This is just to help give the perspective of the magnitude and reach that Walmart has. In America today, there are approximately 4,800 community hospitals, and those are actually on a decline every year. When what we see is versus the number of 5,200 is the amount of Walmarts that live and reside in America today. So as you see, more Walmarts than there are community hospitals. So what an amazing opportunity for this company to jump in and the leadership to really impact healthcare in America. 150 million. This is, I ask this question typically in a live audience. And I'll say, what does 150 million mean? And people say, people that visit Walmart a year. And I'm like, well, it's close. But it's 150 million is the amount of U.S. citizens that cross a Walmart threshold every week. So not a year, but every week. So 150 million consumers in America today cross the threshold of Walmart every week. And why did this issue become so relevant to Walmart and to the leadership there? So 25,000. There is the median income in most rural America today for a family of four. So $25,000 for an annual income and have to deal with just their day-to-day life expenses, but then add healthcare expenses on top of that can be quite mind-boggling and overwhelming for consumers. And then to dig even farther is 156. And $156 represents the amount a family of four on that median income of $25,000 has to spend on groceries a month. So $156 is pretty mind-boggling to me and to our team as we dive into this. But this is a prime example of what we and what Walmart has classified within their CX organization as their time-sensitive busy family. So a family of four, think of two kids, both in a working home, trying to face this. So as we designed the work for Walmart Health, we kept this family in the center of everything we did. I'm going to share a little bit with you around the leadership of Walmart Health and Wellness and their stance and what they're looking at. But I'm hoping here, I'm going to turn and see if this works. Because we forgot to test this one. You know, I'm going to go on to this next slide. This was an article titled 2 weeks ago in Bloomberg that says Walmart takes on CVS and Amazon with low-price clinics. So in August of 2018, Walmart named their new leader, Sean Savinsky, as the CEO of Walmart Health and Wellness. Sean has a 20-something year journey in the wellness space, in the health space, has worked for a payer, has done turnarounds, and he was quoted a ton in this particular article on how Walmart is looking at tackling this low-price clinic concept. And you see a picture on here, and this is actually the front of the clinic in Dallas, Georgia, that opened on September 13th of last year. And so let me give you a little bit about Walmart and what's happening with Walmart. In 1978, Walmart opened their first fully owned and operated in-store pharmacy. And when we talk about disruption and acceleration in this space, I want you just to begin to look at 1990, the first 3 Walmart Vision Centers were opened. In 2006, the $4 prescription program was tested and launched. And Walmart was told at that time that it would not succeed. And we are in 2020. Not only did it succeed, but it actually changed the whole pharmaceutical and pharmacy perspective to now today, not only can you get $4, but you can actually get free ones. Then 2014, the first Walmart Care Clinics launched. So over several years, 19 care clinics were used to prototype what today is now known as Walmart Health. And again, I mentioned September 13th of last year, it was opened in Dallas, Georgia, and on January 29th of this year was opened another one in Calhoun, Georgia. So brief background there. What I want to dive into and where the partnership of HappyOrNot becomes relevant in what we do is we work with an amazing team internally around consumer experience, patient experience, provider experience. Our main partner in that journey is a gentleman by the name of Matt Perry from Walmart, and the team led by Marcus Osborne from the operational side. Then again, ultimately led by Sean Savinsky. And the whole experience design principle work, why we brought HappyOrNot in, is what we learned is we wanted to base this new experience around cost, convenience, and care. So how do we bring a new pricing model? How do we make it convenient? And then what does care look like? And all of those experience design principles set on top of this know me, make it easy for me, and care for me concept. And I'm going to dig into those a little bit here for you guys to be able to understand. So what we wanted to do is we wanted to provide quality medical care at low prices that we say that you'll love because no insurance is required. So how do we bring a price transparency model, a cost model that brings quality and value to consumers? And so these numbers I'm showing you here are public numbers. You can go on the site to see. So when you think about behavioral health and counseling, right now the rate for that service is $1 per minute as a new patient, so that's $60 an hour, or as an existing patient, $45. If any of you have ever tried to use your insurance in this space, you can't even touch it for that type of price. Then one of our biggest surprises, but not a complete shock, is around the dental space. So you can do your dental exam with teeth cleaning and x-rays for $50, or a dental exam for use at $40. And as well, when you look at medical sick or injury visits, $40, annual checkups $30. annual use checks of 20. And so what does that mean to the market and what's happening today in healthcare space? What we have found is that we're still running at in the same high number of cash-based services, and people not even using their health insurance because it's actually cheaper for them to pay cash. In the very first week we were open in Dallas, Georgia, we learned of a mother with 4 children who had not been able to have any dental care in several years. But the 5 of them were able to come in and for $250 was able to get this type of service. And it was transforming to that mother and to that family. So how do we bring these low cash prices? How do we bring the transparency and quality and value? We joked around this, but we were very aware around this. No, we did not hire our doctors from Tire and Lube or any of our medical assistants from Produce. We have brought high quality clinical and clinicians and providers. So there are providers in each of the locations. There are nurse practitioners and then certified medical assistants and above to help assist with patients. So quality and value, very high. It was a challenge from Sean Slavinsky that we don't jeopardize any of that around cost as well. Convenience, you will see here the pictures of the second location in Calhoun, Georgia. So known and quoted in that Bloomberg article is around the super center for health, integrated healthcare access, hours, and technology. So let me talk a little bit about the integrated healthcare access. You can actually kind of see on the sign there that what's offered today in the space is primary care, counseling, hearing, dental, labs, x-ray, optometry, even point of care, along with the full vision center and the full pharmacy. You see a picture of the new, what we classify as the pharmacy of the future down below there as well. So a completely, what I would call open integrated system. So any consumer can use this system and come in and get all these services. As well as hours. You go back to the dental example. I don't know about most of you, but me trying to get in to see a dentist where I live in Cincinnati, Ohio, I typically can get in to see a dentist on Monday afternoon, Tuesdays, Wednesdays, and Thursdays. What we are offering to everyday consumers at this point is 7 days a week, 7 a.m. to 7 p.m., 6 days, and then I believe it's shorter hours. It's still like 8 to 6 on Sundays. So you can actually get dental service on the weekends. And then a technology that's driven to be user-friendly, to make online appointments, as well as to make check-in and check-out very easy. One of the exciting things and how we use all of this is really around the care model, which is, again, where we use real-time data from HappyOrNot, both in this convenience space, so consumers can leave feedback around the layout of the location. We continually bring consumers in and tweak the model around this, so continually to get feedback from them. Which will lead me to this whole care thing. You will see this motto. Our motto is we create moments of care for everyone, everywhere. Sean Slavinsky challenged the CX group and at the very beginning to build a model of care that was like nothing that we had seen in the healthcare space. So we partnered with Disney Institute to bring about a new program called Moments of Care that led to a second program called Language of Care. And I'll dive into each of these 3 components of care as we move forward. That we have created a care host model. So you are greeted when you walk into a Walmart Health by a care host at the door. They will help check you in. They will help get you everything that you need. to get you through the journey there. And then you will stay with that care host throughout your journey until you check out. But around that, we built this Moments of Care program with the Disney Institute, gave these pillars, these purpose around we create moments of care for everyone everywhere, created 4 pillars that then we launched a whole training to not only the Walmart Health team, but to approximately 70,000 associates within Walmart Health and Wellness. Did that within 5 months to give a common ground and a common purpose for all of them. And then we were challenged to even start to look at how we were speaking. And so we created the Language of Care program that is starting to roll out in some pilots and some prototypes, even as we speak within Walmart Hair and Walmart Health there. So going back to this whole concept of cost, then obviously the convenience part and the care part is what brings me to this next slide, which I will talk about the partnership with HappyOrNot and what the benefit of that has been for us. So those of you that have used HappyOrNot or have seen what HappyOrNot does, real-time feedback. I am, as you know, from an outside consulting group, I have a very different philosophy around Net Promoter Score. Some of you may track Net Promoter Score within your industry or within your company. Have not been a huge fan of Net Promoter Score as I worked within industries because it can be pretty easily made in whatever direction you want it to go in. But what HappyOrNot has done for us is to be able to make it easy, going back to our experience design principles around know me, make it easy for me, and care for me. So make it easy for the consumers to provide real-time feedback that then the clinic administrators and the clinic directors can look at and see if we have a bottleneck in our experience and along the journey in any place. And if we do, to be able to start to tweak it and move forward with it in a productive way, because as you know, if any of you guys do consumer satisfaction scores, or if you work within a hospital system, sometimes you don't get any of those results back at the quickest 30 days, but sometimes 60 to 90 days out after an incident has happened. And so your service recovery model becomes really difficult to fix in a proper timing and maybe create that moment where you can, again, surprise, know the customer, care for them, which is a model that I learned in service recovery when I worked for Disney, and a principle that we live by here within Mophie around making this premium experience as fast as we can and as easy as we can. And so it's been a really powerful time with this partnership with HappyOrNot in Walmart Health, but also within HappyOrNot in the Walmart pharmacies. So using that real-time data daily to look at and to manipulate the experience has been powerful for us. So with that, I tried to leave plenty of time and get through around anybody have any questions at this point? I know that you have a box that you can type some questions into and that they will prioritize. But do we have any questions at this time?
Great. Thanks very much, guys. Yeah, a very insightful case study there. I really liked the delving into each of the pillars of the experience design principles and seeing how that then lays out for the end experience for the customer and sort of the care that they feel at the end of the process. So indeed, as Sean mentioned, we now have time for Q&A. Please do enter in any questions that you have for Sean and Colleen. in the Q&A chat box. So, you just put in your question and you click that submit button as well to make sure that it transmits through to us, because indeed it would be a shame for us to miss any questions that you guys have. So we've got a couple of questions that have come in here. Let's start off with the question that wants to know about how you connect the Happy or Not feedback to your KPIs to really sort of track and measure the success or perhaps any sort of sticking points of the experiences that you're laying out for customers.
Yeah, so how we connect it to the feedback to our KPIs. One of the things that we've been real attentional on at this point is to not come up with a set, clear, actionable list of KPIs that we're tweaking. So one of the things, we have some wow moments identified. One of those wow moments would be a KPI around a wow moment would be around to not wait 15 minutes or longer for your service. And if you've had to wait that long, why and what can you do to fix that experience? So maybe not in the traditional KPI manner, but it's very much an experience-driven performance indicator, as well as did you feel cared for today, around our language of care and our moments of care, asking, aligning around those pillars. I can't tell you all 4 of those pillars because we don't publicly put those out as a team, but how does that real-time data align to those KPIs that then, again, the clinic administrator or Matt, who leads the CX experience, what can we then go and do around those moments and those coaching moments that we can potentially have with our associates.
Great. In fact, we have a question here that says, with the low cost and the 150 million visitors a week, they can only imagine that long lines and long wait times are a reality. You tapped into this a little bit in your answer just then, but is that one of the reasons that Happy or Not was used to sort of check on that? So I know you were mentioning about the 15-minute time, the wait time. Yes, so how else are you sort of weaving that in to help manage with the wait times?
Yeah, so I think this is a great example of how we do can use Happy or Not is managing those times. Again, I just touched on it. We have a wow moment that says, we don't want a patient waiting more than 15 minutes. What's actually pretty powerful, and this is, we do take walk-ins, but we slate them into appointment times. So around, long lines and long wait times, it's pretty impressive to this point that we have not had too many instances where that has been a big issue for us, although we're seeing high volumes in the clinic.
Great stuff. So at the end of your presentation, you delved into the area that looked at care. So Megan here is asking if you could maybe talk a little bit more about moments of care. Are there any specific examples that really sort of blossomed thanks to these sort of experience design principles that you have rolled out?
Yeah, and thanks for the question, Megan. This was one of those double down moments for Sean Slavinsky, the new CEO, said, we have got to transform the care experience, not only within Walmart Health as we launched them, but within our pharmacies, within our vision centers. And so we doubled down heavily in 2019 on the moments of care. So just a high overview. Again, I can't give you all of the pillars because we haven't released all of those publicly, but every associate within Walmart Health and Wellness goes through a 3.5-hour training around the purpose that we create moments of care for everybody, everywhere. They go through a 3-hour training, 3.5 hours. and walk through those 4 pillars, create that common goal, common purpose around those 4 pillars. And then if you're a leader, there's an additional 3-hour training that you go through on what's expected as a leadership to live out moments of care. And within even that training is how do you do coaching sessions, because you're doing a complete, I don't want to say complete, but you're bringing a new mindset in, you're doing a new cultural shift that gets very focused on the patient and the consumer. So we also said we had to spend just as much time training leaders in how to walk this walk and talk the talk, but then how to be able to coach associates when those moments don't happen. So everyone either gets a 3.5-hour or a 6-hour training, depending on your level within the organization. And again, that was a training that we rolled out to all 70,000 plus within about 5 months. And now we're looking back at it, going, what do we need to refresh? And again, that's where the language of care concept started to come out. Was, okay, we're aligned to these pillars, but then how do we talk within those pillars? What are the things that we said? And we're testing that model now within the organization with some areas. And how do we bring that together? And when I say everyone's trained under health and wellness, that's pharmacy, that's vision, that's all the clinics, any piece that touches any type of health and wellness piece. So hope that answers.
Great, thanks. You mentioned in your answer there about language of care. So the question we've got here from Dana is asking about how were you able to overlay new language and mantras that were healthcare specific, but did not compete with other experience principles Walmart was trying to drive across other customer experiences, for example, gardening, grocery, in the broader organization?
Yeah, so I would say one of the powerful things that we have seen through this and been able to learn from this is, we knew that within the stores that they do some type of specific training around retail, but not necessarily very specific to the language, this moments of care that needs to be very healthcare specific. It has gone so well, Dana, within the org, that the global HR organization has started to meet with the team to see what they can learn from this and potentially start to roll out within the retail side of the organization. It's still very much in the early stages, but we had such great success. I can't give you wildly what the numbers are, but Walmart does measure NPS. And we've seen such an increase in the NPS score within health and wellness that it's now leading the organization across the company. So people are starting to look at it and say, okay, what's the basics behind this that then we can translate into a retail experience and maybe take even out of that healthcare specific. But we knew, Dana, we had to go create a very healthcare specific way of talking and way of treating that was going to be very different than potentially what the retail experience was.
Great. And in terms of the Walmart health personnel, Tajma here is asking, where are the Walmart health personnel coming from? Is it local hospitals, medical schools? Where are they sourced from?
Yeah, so this was an interesting dilemma that we faced, in particular with the very first one. When we were launching the very first Walmart Health in Dallas, Georgia, we could not give a lot of information out when we were hiring, but yet we didn't have a shortage of applications. I was saying now going forward after that first hiring for the first clinic, moving to the second clinic, once people knew what it was, we're getting resumes from all over within the ecosystem, from hospitals. One of the doctors in our very first location actually had a community practice that he actually closed and, came to be our doctor. And so some of those patients came with him. But yeah, we're getting it from across the whole ecosystem. And now actually not having necessarily a shortage of being able to hire people for these positions as they begin to roll out.
Great stuff. So let's take a look at some of the hurdles that you guys had to negotiate. Jesse here wants to know, what was your biggest hurdle with working with a Fortune 100 company and wanting to be a disruptor to change the consumer experience?
Yes, thanks for asking that question, Jesse. Biggest hurdle is speed. So again, Fortune 1 company, massive organization, that's a Fortune 1 company for a reason, that they do amazing stuff. But when it came to speed and it came to, they had done pharmacy and vision and dabbled in the clinic space for a while, but building out a full healthcare model, delivery model, can be frightening in this kind of space. So I think our biggest hurdle through the whole journey has been speed, but that's starting to get a little bit better every day.
Great. Inevitably with healthcare or indeed pharma, there's a lot of regulation and things to negotiate. So inevitably sometimes speed can be quite a common challenge to negotiate. So Andy here wants to know whether there was any friction between the cost goal of keeping prices down and also the care goal. So the taking of time, maybe money, putting resources into those moments of care. Was there any friction there, and how did you get around that if there was?
Yeah, so I think there will always be a healthy friction between that cost and care experience. I think for us, our team and the team that we worked with within Walmart Health, Sean Slavinsky challenged us to always build this model from the patient back, so care leads over cost when we have to look at that. So how do we continue to provide the care experience in a way that can still meet the business goals, but always lead with the patient first? And so in that, when those moments of friction happen, our team takes the lens of patient first. And that's what is healthy with having a cross-collaborative team, is that we are able to bring that lens while others have potentially another lens that they bring to it. But there's always going to be that healthy friction there.
Yeah, of course. So in our last session, we touched upon the idea of survey fatigue, of trying to be intelligent about when you are surveying people and trying to sort of meet them in the moment. So Anita here is asking, at what point in the customer journey do you survey, and what do you do with that data? Of course, it's great having data sitting there and looking pretty, but it's got to then be used to create value and generate some action. So yes, what point in the customer journey do you survey, and what do you do with that data, or some examples of how that data has been used to drive change?
Yeah, so how we use the data and where we do the surveying. At different moments, we survey different experiences within the clinic to just maybe focus on a particular service or product within the clinic. But then we also try to survey the full journey through the clinic. And what we do with that data is we look at it weekly. We get the internal team gets a report to look at it to say, okay, our HappyOrNot score was this. Here's some of the feedback that we've got that may be concerning. And then our team, along with the internal CX team, look into that and starts to say, do we need to adjust the experience model within it? Or do we need to look at going back and doing some moments of care training and identifying that point within the experience and the journey or the service or product that we go do some focus on.
Great stuff. So I think we've got around 5 minutes or so for the questions and answer section of today. If you do have any questions, make sure you enter them now. We'll get to as many as we can. We're seeing a lot filter through here. But if we don't manage to get to your question in today's session, we will be sure to make every effort to reach out to you afterwards to get you your answers. Right, so we have a question here which is asking about the places of investment. So a lot of times within CX, there's a need to make sure you prioritize well. You've got to prove your value quickly. So you of course have to prioritize your investments into areas that will breed value and breed some sort of meaningful change for your customers. So this question is asking, how did Walmart determine which product lines and services to invest in, behavioral, dental, for example?
Yeah, so going back to when I opened up on the presentation, again, using qualitative and quantitative research, surveyed 28,000 consumers. And part of the reason we did that was to see what the needs were of consumers for products and services. And then there's an amazing team that sits under Marcus Osborne, led by Evan Shar within Walmart, that does deep dive into products and services and to explore what needs to come up. We're working on some of that now. What do we need to tweak on? We help the organization start to look at the industry externally. So, but the biggest way we did it was just taking our consumer feedback and our consumer data that said, here is what consumers are wanting and say they need.
Great stuff. So you've mentioned in a couple of times in the presentation NPS. I know there's a big following for NPS. There are a few shortfalls with NPS as well. So this question is asking, instead of NPS, how does the Happy Index differ, and why is maybe that preferable? And I guess what could be quite helpful here if you maybe give a bit of context or background on the Happy Index with this answer.
Yeah, so again, for us, and I would say this for me, I'll even get very specific from the multi perspective. NPS, that whole index is based around would you recommend this product or service, and that is really hard to do in the healthcare journey because it's not like it's happening always. This journey is not always in the most positive times in your life. So would I recommend it? Not always, but would I recommend how you're treated and how you're cared for? Yes. So for us, how we use this, a very differentiating factor is just in that. And the index is, we're not looking at necessarily for our team. Walmart is looking at, would you recommend the whole product and service? Awesome. We want to get very granular into the experience and how were you treated? Did you feel cared for? And so that's where the index is very different for us and how we use the index from the HappyOrNot. And that's what we love about the happy faces versus the sad faces in reaching our customers. It still uses some of the same algorithms behind it in a different way, but using that index, the Happy Index for us, from an experience standpoint, allows us to dig into things initially right away. So don't know if that helps completely, but hopefully.
Great stuff. All right, so I think we've got time for one more question to squeeze in before we close. So Sean, this is a big launch with a big organization. If you could have a do-over, what would you do differently in creating the patient or customer experience? And how could the HappyOrNot system make a difference in making that happen?
Yeah, so, anytime you are on this type of journey, you look back and you go, oh, I would possibly do that different. And so the greatest thing about the leadership in particular Sean Sapinski's vision around this, is that we are still not perfectly tweaked the model. So in the next opening, which was announced would be in Loganville, Georgia, we are tweaking some of the experiences. We're tweaking some of the services and taking that learning. And again, tying it back to HappyOrNot, using the real-time data for us and not having to wait 30, 60, or 90 days to get customer satisfaction surveys back is huge. Because as we're tweaking the model, tweaking the services within Walmart Health, we can use that real-time data immediately to start making experience decisions and ultimately some business decisions.
Yeah, you're totally right there. That lead time between the customer submitting the feedback to then it being received and then turned into action, if that's lengthened out, that really can, kill an experience, or that time that you've got to recover the experience. And so anything that can be done to shorten that down and make it more real time is only a great thing. Yes, great stuff. Thanks so much to Sean and Colleen for being with us today. A lot of insights for us to take away and to take on our journeys with us. So like I said, if we haven't managed to answer your question, we will be reaching out to you at a later point in order to get you your answer. And of course, today's session will be made accessible on demand. So if you'd like to revisit it, there's a lot of content in there. You're more than welcome to revisit the session. We will be distributing a link with you guys so that you can watch it on demand. And of course, if you have any colleagues that didn't get a chance to make it today, share it with them so they can get involved and see the insights that we've learned today. And of course, if you'd like to get in touch with our speakers today, feel free to connect with them on LinkedIn via the links in the speaker box. And also don't forget to check out some of the resources that we've got in our resource center today. So all that's left for me to do is to thank everybody for joining. Thanks again to our speakers. And if you've participated in our sessions today, you're almost there to be entered into a prize draw to win some Amazon vouchers. There'll be more on that later. And when we close the session today, you'll be prompted to give a little bit of feedback, quite topical. Yes, some feedback on our session and the event so far. So we would really love it if you could take a moment of your time to send in some of your answers. So that is it for today. Please tune in tomorrow at 9:30 a.m. Eastern Time for 2 back-to-back case studies from Dublin Airport and BNP Paribas. And that's it for today. Thanks, everybody, for attending.